Musculoskeletal in the lay population is a very unusual term. Most people haven't heard of it, but actually NHS throughout the UK now, if you're referring to orthopaedics, you're usually seen by a non-surgical team first to assess you. And that is called the Musculoskeletal Clinic. And Swansea has had one since 2000. And it sees about 20,000 patients a year very successfully. I was head of that from October 2000 to July 22. What are we seeing? We're seeing a lot of people with arthritis, but maybe people who aren't ready for a replacement. We see a lot of clearly back pain and sciatica. We see a lot of frozen shoulders and impingement type problems, tennis elbow, tendinitis virtually anywhere in the body. I tend to see a lot of stress fractures and bone stress injuries. Some of them exercising females who are perhaps on the edge of overtraining. Increasingly that you're seeing that in men who do a lot of cycling as well, that they might get bone health issues because they just cycle hundreds of miles a week sometimes, but they don't do any weight-bearing exercise. So a lot of what we do in a musculoskeletal clinic, a lot of it's about lifestyle, a lot about is making changes and teaching people how to exercise safely, that it's okay to avoid fear of injury and making things worse. Common question is, have I done any damage? And it's no, exercise is never a bad thing. And there's always a focus on calories, etc. But actually exercise is just as probably even more important. And the truth is that we've got a large section of population who are improving their. You go to the Mumble seafront every day, you see people running and it's brilliant. The advent of personal trainers, high intensity exercise, terrific. But they do sometimes bring problems that stop people participating, and that's where someone like me comes in, working with a physio very often.